we have this wonderful lady who is going to be going to the OR with us fairly shortly in a couple weeks' time to do a little cluster of procedures. We're going to do an upper lid blepharoplasty, lower lid blepharoplasty. We're also going to do some fat transfer. So we're going to take some fat from the belly or maybe the lateral thighs. And this is a nice slender gal, but as you get a bit older, of course, there's some volume deficiencies that develop. And so in the office, this is something we can do with fillers, but when we're in the OR, we quite frequently do it with fat transfer. And so tell us in your own words, is that a decent description of what we're trying to do? You're trying to revitalize this area around your eyes?
Yes.
There you go. And then a lot of you guys out there in internet land, you might be watching this and what have you, and asking yourself the question, so, that's fine. I kind of know what I want to do, but who do I go see? So tell us a little bit about your process. How did you decide to come to us? What was in your mind?
Well, I was unhappy with my eyes, so I started doing research because I was like having burning and my eyes started kind of like drooping down. And so I just started checking into it on the internet and I found that I needed upper. It said upper. And then I started researching who did that in my area, and I came across you and a couple other people, but you were the only one that specialized in face only. The other people specialized in all body parts. I just prefer someone that specializes in what I'm looking for, which is above the shoulders.
It makes all kind of sense. You're singing our tune. If you really think about it, pretty much every other area of surgery, you don't really go to see an orthopedic surgeon that does all kind of orthopedics. That's rare nowadays. If your dad's spine's got an issue, you go to a spine surgeon. If you need your hip replaced, there's probably somebody in town who's pretty much doing hips most of the time. And so in that same sense, we love the fact that, we can focus on a limited number of procedures, both surgical and non-surgical, above the shoulders, so to speak. And so we spend a huge amount of energy and time thinking about these things, doing these procedures, going to meetings and talking about these things, and so we think it makes all kind of sense.
It makes me feel a lot more comfortable.
Yeah, this is not an afterthought. Nothing we do is an afterthought because we do a limited number of things with a high volume. So good. Well, we're looking forward to this. I think it's going to be a great case, and looking forward to taking you through your journey and showing you your progress, so you can follow us out there in internet land. So thanks so much. So we have this delightful lady. We just had a lovely talk about family stuff.
Yeah.
She's now 4.5 weeks out from an upper lid bleph, a lower lid blepharoplasty, and then fat transfer from the tummy to the tear trough area and the midface. And so tell us, it's 4.5 months out, and of course there's still a process to go. There's several months more of a little bit of reduction in swelling and what have you. And so tell us, how was it? We've just looked at the pictures. Any thoughts on the pictures?
I didn't realize how good I looked till I looked at the pictures, but my thought on it is if you're gonna get it done, don't look at the internet. Because things move slower than you think. And you think you're supposed to look like normal in 2 weeks, like the internet tells you.
And it's interesting. Here's the truth. We do have patients that at 2 weeks, it's, stone cold normal is a bit of an exaggeration, but they look pretty darn fantastic, okay? On the other hand, we always tell patients there's a little bit of a diversity, you could say, between patients who take less time for swelling to resolve and more time. That's absolutely true. At 2 weeks, it was still looking a bit swollen. You were still seeing some stuff. Now we're at 4.5 weeks, and I think certainly at 4.5 weeks, you could go into any restaurant, you could go to any social event with no makeup on, and I think there'd be no issue. So really the rest of the thing is just about sort of you're on a glide path to subtle reduction in swelling, above the incision and around where the fat transfer was done. Just subtle refinements over the next couple months, and we'll keep close contact with you. That's the update for this wonderful patient, and we'll give you a few more updates when we're all done with the healing process. We have this lovely lady here, and she is now 3 months out from her upper eyelid lift, lower eyelid transconjunctival removal of the fat pads, and then we also did some fat transfer into her sort of tear trough and the area around the eye. And so we're well along with the healing process. Having said that, at 3 months out, there's usually a little bit of residual swelling still above the eyelid, and so that might take another month, maybe even 2 months to completely sort of dissipate. And then the incision that we were just talking about, the incision matures over many months. Give me your own thoughts. We're 3 months out. What's cooking?
My eyes feel better. It's like a long process. It seems like a long process, but it doesn't feel like my eyes are as heavy or there's like fat sitting on top of my eyes and weighing them down. Underneath, I definitely see I used to not really wear makeup to cover up my dark bags or whatever, and I don't have to do that anymore.
So that's fantastic. We're 90 days in, and I think you can go anywhere around town, anywhere around America, and you look natural. Nobody's sort of gasping at you. You know, after 3 months, you'd certainly expect that. But you're absolutely right. It is a process, especially when you're looking for these fine, sort of the final resolution of little bits of swelling, little bits of sensation of healing and this kind of thing. It is a process, and we always are very upfront with our patients. You know, this is not like a boom, boom, 2 weeks and you're done. Maybe that's when the worst of it is over, but it takes a little while to see the final result. Thank you for this update, and we'll see you here in a couple months, and I think then we'll be really looking at kind of the final result. We are now 5 months out from a procedure with this wonderful lady, and when she first came into the office, she was concerned about a number of issues all around her eyes. And so she had a little bit of upper eyelid dermatochalasis, which is a big medical word for too much skin on the upper eyelid, and very specifically right in this nasal area here, which means the upper eyelid portion that's near the nose, there was this poofy sort of fat pads here. And so that was one concern. Another concern is she had under eye fat herniation or fat pads. And then finally, beneath that, she had these tear troughs. So what did she have? She went to the operating room and she had an upper eyelid blepharoplasty with specific focus on removing those nasal fat pads. Number two, we removed this fat herniation using an approach where we go behind the eyelid, which is the best way to do it. And then we also harvested from some fat, typically from the belly or the thighs, and then we put it into the tear trough area. And so here we are 5 months out, and it's really healed basically completely. Even as I look at her, I think I'd have difficulty telling, even on close examination, that there's any surgery that's taken place. So tell me, what's your own impression? It's been 5 months and you're looking at it. How does it look to you?
I'm happy. I feel more refreshed, and I don't feel like the fat pads are like lifted off my eyes. The top of my eyes feel like lighter. Like it doesn't feel like there's a blob hanging off my eyes. And definitely the underneath, I can tell a difference. I used to put makeup there just to cover the bags, but I don't even do that anymore.
All right, so that's pretty much the final result at 5 months. The little incision on the upper eyelid, we always tell patients out to about a year, it gets smoother and smoother. But what you're sort of looking at there, these before and after pictures and seen in these videos, is the final result.